Welcome to the Hearing Conservation Training Module. This module will cover the following topics: the anatomy of the ear, how sound works, how the ear interprets sound, the effects of noise on hearing, how to protect yourself from hearing loss, and annual audiometric testing. There are 5 main parts of the ear involved in interpreting sound. The outer ear collects the sound waves. The ear canal delivers the sound waves to the eardrum. The eardrum passes the sound waves on to the middle ear. The middle ear consists of 3 bones, called ossicles, which amplify the sound waves. The inner ear receives the sound waves, and tiny hair cells, called cilia, convert the sound waves to nerve impulses that are sent to the brain. Sound consists of pressure changes in the air caused by vibration or turbulence. The pressure changes produce waves that travel away from the vibrating or turbulent source. The 3 properties of sound waves include frequency, amplitude, and duration. Frequency measures the length of the sound wave. It determines the pitch or tone of the noise. It is typically measured in hertz or cycles per second. Noise with higher pitch has more potential for hearing loss. Amplitude is the height of the wave. It determines the volume of the noise. It is typically measured in decibels or dB. Noise with higher volume has more potential for hearing loss. Duration is the length of time for noise exposure. There are 3 different types of durations: continuous, intermittent, and impulsive. Continuous noise includes constantly running machinery or equipment that runs for long periods of time. Intermittent noise includes power tools or equipment that runs for shorter periods of time. Impulsive noise includes noise that has a duration of less than 1 second, such as a firearm. Noise with a longer duration has more potential for hearing loss. At higher levels, each of these 3 properties of noise have increased potential for damaging hearing or resulting in permanent hearing loss. Sound waves are produced from a vibrating or turbulent source. The sound waves travel away from the source, enter the outer ear, and travel through the ear canal to the eardrum. The waves hit the eardrum and cause it to vibrate. These vibrations pass to the middle ear, where 3 tiny bones amplify the power of the sound. The vibrations then cause the tiny hair cells of the inner ear to move. The movements of the hair cells send electrical signals to the brain to interpret the sound. The hair cells are an important part of interpreting the sound waves. If they are damaged, permanent hearing loss can occur. If the cilia, or hair cells, are damaged, hearing loss will occur. Hearing loss can occur from several sources, including ear infections, aging, impact, childhood diseases, medications, or from repeated exposure to excessive noise. Noise-induced hearing loss occurs gradually over long periods of time as more and more hair cells become damaged. Noise-induced hearing loss typically has no visible signs or pain. Once hair cells become damaged, there is no medical treatment to repair the cells, so the hearing loss is permanent. Some examples of noise levels are 30 decibels, a gentle breeze or whisper; 45 decibels, a watch ticking; 60 decibels, a normal conversation; 75 decibels, a vacuum cleaner or dog barking; 90 decibels, a power lawnmower or hairdryer; 105 decibels, a jet flyover or snowmobile; 120 decibels, a chainsaw or rock concert; 135 decibels, a jackhammer. Testing has shown that noise exposures of greater than 85 dB for an 8-hour time-weighted average, or TWA, may cause hearing loss. Use of properly fitting hearing protection will reduce noise exposure to a person's inner ear. Your employer is required to monitor the noise levels in your work area. They will inform you of the noise levels and may require hearing protection in high noise areas. The next section will describe how hearing protection works. Hearing protection prevents hearing loss by reducing or blocking the sound waves from entering the inner ear. Hearing protection devices are labeled with a noise reduction rating, NRR, that is measured in decibels. The manufacturer determines the NRR value based on testing under the best case conditions. To estimate the actual noise reduction for a hearing protection device, subtract 7 from the NRR number and divide by 2. The adjusted NRR value is then added to 85 decibels to find the maximum decibels of protection. When choosing hearing protection, consider the following. The NRR needs to be adequate for the noise exposure in the work environment. For example, an earplug with an NRR of 33 would protect against a maximum of 98 decibels. 33 minus 7 divided by 2 equaling 13. 13 plus 85 equals 98 decibels. The protection should be practical so it will not interfere with work. The device should be properly fitted. The two main types of hearing protection are earmuffs and earplugs. The next pages will discuss the two types and their advantages and disadvantages. Earmuffs are insulated cups that cover the entire ear. The cups are filled with a sound-reducing material to prevent sound waves from reaching the ear. The cups are attached to a headband that should be adjusted to ensure a tight seal around the ear. Oil and dirt may harden or damage the material, so it will not provide a secure fit. Keep the cuffs clean by washing them with soap and water. Earmuffs should be replaced when the cups are worn, the headband is bent, or the foam inserts begin flaking. The advantages of earmuffs is that they are easy to use, designed to fit anyone, they won't irritate the ear, and they are reusable. The disadvantages of earmuffs is that they are heavier than earplugs, they can be uncomfortable if working in a hot environment, they are bulky, and you must keep hair, glasses, or other personal protection equipment away from the seal. Earplugs are made from foam or other soft materials and are designed to fit inside the ear canal. Earplugs block the sound wave from entering the inner ear. Before inserting earplugs, make sure to wash your hands to help prevent ear infections. Earplugs can be inserted by rolling the plug between the thumb and forefinger, pulling the outer ear upward and back with opposite hand, gently pressing the plug into the ear canal, and waiting a few seconds for the plug to expand. Earplugs should be replaced if they become stiff, cracked, or dirty. The advantages of earplugs are that they are small, lightweight, inexpensive, comfortable, and may be worn with other personal protection equipment. The disadvantages of earplugs is that they may irritate the ear canal. They are easy to lose, you must wash your hands before inserting, they only protect from noise exposure up to 105 decibels, and they must be inserted properly. An 8-hour TWA of 85 dB is called the action level. Employers shall administer a hearing conservation program for employees in work environments where noise exposure equals or exceeds the action level. Some of the elements of the hearing conservation program include sound level monitoring, employee notification, and audiometric testing. The next section will discuss audiometric testing in more detail. Workers who may be exposed to noise levels at or above 85 dB for an 8-hour TWA should have annual audiometric or hearing testing. Hearing tests measure a person's ability to hear over a range of frequencies. The tests are designed to measure the ability to hear at the frequencies corresponding to human speech. This is the best way to check if the hearing cells are picking up sound. Test results are compared to look for a significant change in hearing, called a standard threshold shift, or STS. An STS could be caused by a number of things such as a head cold, listening to loud music, or working without ear protection. If an STS is detected, a retest will usually be performed. Prior to a hearing test, avoid loud noises for 14 hours. If this is not possible, make sure to wear hearing protection. The test is conducted in a soundproof booth. You will be seated and given headphones to place over your ears for about 10 minutes. The tester will ask you to signal when you hear different tones. Tests are separate for each ear and cover a range of frequencies and volumes. The results of the test show the sensitivity of your sense of hearing. Your annual audiogram should be compared to your previous test results. Hearing plays a critical role in our everyday lives and should be protected whenever possible. Remember, once your hearing is gone, it's gone. You must take steps to protect it by understanding the noise levels you are exposed to and wearing hearing protection both on and off the job when necessary.